In tonight's Health Watch, new flu numbers from the CDC show activity is still high around the country.
And experts say this flu season is a little unusual. Dr. Max Gomez here now to tell us how something called telemedicine is helping. Doctor.
That's right. But, you know, flu season is always a little bit unpredictable, right? Mostly because experts have to make educated guesses as to which virus strains are going to be circulating and causing the flu each season. But this year, the strains that are out there are kind of showing up in a backwards order than usual. The Centers for Disease Control and Prevention says overall flu activity has declined over the last few weeks, but still remains high. Flu B viruses have been dominating so far, but
we are starting to see influenza A viruses also increasing. And so exactly what that means, we don't know.
Since influenza A, which tends to impact children and younger adults, has been the main circulating strain so far, and flu B viruses tends to cause less severe illness, especially in older adults, the CDC says that may explain why hospitalizations and deaths are not yet as high as in previous seasons. So far this season, there have been at least 13 million flu illnesses, 120,000 hospitalizations, and 6,600 deaths. 39 children have died.
The majority of those deaths are in kids that had influenza B infections, and only about 8% of those were vaccinated. We know the vaccine can be effective in preventing death.
One thing that's making the flu season a little easier for families to cope with is telemedicine. The Martinez family has 2 kids sick with the flu. They're seeing the pediatrician online.
They don't have to just get dressed up and get in the car and just go out of the house.
Dr. Kathleen Birchelman says more patients are using telemedicine to see doctors virtually during flu season.
You can get a full exam via telehealth for the flu. We can send you to a laboratory for testing if necessary, blood tests, flu test, chest x-ray.
Now, with weeks or even months of flu ahead, federal officials, health officials say it's still not too late to get your shot. The CDC says data so far indicates the vaccine overall is a pretty good match, but it'll be several weeks before health officials know for sure. And flu never really goes away completely. Even during the summer months, it's still out there, so it's still a good idea to get your shot.
All right.
Thank you, Dr. Max.
You bet.